Welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman and Associates. I will be the moderator for today's webinar. Before we begin, I would like to highlight the two main features of your webinar interface. To the left side of the screen, you can see the first PowerPoint slide of the presentation in the main window. To the bottom right side of your screen is the Q&A box. Today's question and answer period will be at the end of the presentation. However, you can enter a question for our presenters at any time in the Q&A box. During today's webinar, a video will be shown. In order to watch and hear the video, you will need to be logged into the Adobe Connect platform. If you have called into the webinar, you will hear the audio only. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You will receive an answer in the Q&A box. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Caring for Caregivers. Our presenters today are Amy Groom, PJ Beaudry, and Barbara Higgins. Amy Groom is a public health advisor with the Centers for Disease Control and Prevention, assigned to the Indian Health Service, where she has served as the IHS Immunization Program Manager since 2001. In this capacity, she works with IHS, state, and tribal programs across the country to support immunization activities for American Indian and Alaska Native people. PJ Beaudry completed his undergrad degree at Boston University with a degree in health science and received his master's in public health at Columbia University's Mailman School of Public Health with a concentration in health and human rights. Currently, he serves as director of the Great Plains Tribal Epidemiology Center and of the Great Plains Tribal Chairman Health Board Sexually Transmitted Infections and Teen Pregnancy Prevention Program. Barbara Higgins is a sociologist and the REACH Community Program Coordinator and trainer for the Department of Preventive Medicine at the University of Tennessee Health Science Center. She has 18 years of experience working with clinical staff and caregivers of dementia patients. She has been a part of the REACH intervention from research to translation to the nationwide implementation of the program. Currently, she is responsible for training, certifying, and coaching staff throughout Indian country to implement the REACH program in tribal communities. The goal will be to focus on the fit and utility of the intervention into tribal communities and have REACH available in at least 50 tribal communities in the next 3 years. I will now turn it over to Amy for an introduction of today's topic.
Great. Thank you so much, Julie and Kaufman and Associates, for inviting us to speak today. We're really going to be focusing on influenza. I think in terms of caregivers who may be taking care of young children, as I do, or elderly people, as I also do with my elderly parents, or taking care of friends or neighbors or other relatives. Influenza is one of those things that can be a very serious health issue for the people we're taking care of. And we wanted to touch today on what we can do to protect both our own health as caregivers, but also importantly to protect the people for whom we're giving care. So before we get started, I do want to just take a quick poll of the folks that we have on the line and see how many of you have gotten or are planning to get your flu vaccine this year. So if everybody could take a moment, so we've pulled it up, and we'll see. Okay. So it looks like the majority of you, we still have some votes coming in, but the majority of you looks like you've already gotten it or at least are planning to get your flu vaccine this week, and a couple of people who are not. And we'll go through some of the reasons why people don't get vaccinated, and maybe if you could type into the chat if there are questions or concerns that you have particular to why you don't want to get a flu vaccine or can't get a flu vaccine, that would be great because then perhaps I could make sure that I cover some of that information as part of my presentation. Thanks for indulging me with that poll. And as you can see from my slide, myself and my 3 children did get our flu vaccine. So just going to start off with some basics. I realize we may have some clinical people on the call, but I want to make sure that we go over the basics of influenza. I think a lot of times people think of flu as a stomach disease. I know I certainly did before I got into public health. And I think it's really important to highlight that influenza is actually a respiratory disease. So it infects the nose, the throat, and the lungs, and it's caused by the influenza virus. The symptoms of influenza can vary. Not everybody will have a fever, but that's certainly a common feature of the flu. Cough, sore throat, runny, stuffy nose, body aches, headaches, and fatigue. So very similar to symptoms that you might suffer a common cold or many other things that may seem like influenza but are not influenza that circulate in the winter. And then there will be some people who may have vomiting and diarrhea, so that stomach manifestation, but that's not a very common manifestation of influenza. And I think the most important thing is to note is that while flu can be very serious, most people who get it are going to recover eventually, and it's in a couple of days to a couple of weeks. They may feel really terrible in that time period. But for a certain group of people, it can lead to hospitalization and death, and that's one of the reasons why we want to focus on prevention of influenza. So we get this question quite a bit. People think about the flu. They say, well, I'll get the flu, I'll get better. Is it really so serious? And I think what a lot of people don't realize is that it is very serious, and depending on the strains that are circulating and how well our vaccine is matched that particular year, anywhere from 3,000 to 49,000 people in the United States die each year from flu-related complications. So that's a pretty significant number of people. And more importantly, over 200,000 people are hospitalized related to influenza complications every year. So it is had a significant health burden. Some of the groups that are higher risk for those flu-related complications that I mentioned and may often end up in the hospital or could die from it are children less than 5 years of age, pregnant women, older adults, and by that we mean adults 50 years and older, and people with underlying chronic health conditions such as diabetes, heart disease, and very importantly, asthma. I think a lot of people don't think of asthma as a serious chronic disease. But these are the groups of people that if they get influenza, it can become very serious and result in hospitalization and even death. So because we're targeting, of course, American Indian and Alaska Native communities, I really wanted to focus on some of the data that we have specific to our communities that we serve. Influenza, one of the leading causes of pneumonia is in fact influenza. So you get influenza and then it can lead to pneumonia. And influenza and pneumonia combined are in the top 10 leading causes of death for American Indian and Alaska Native people. So it really is a significant health issue for our communities. And what we've seen from previous flu seasons is that American Indian and Alaska Native people can also be more likely to be hospitalized and to die from influenza-related illness compared with the non-Hispanic white population. And we saw this particularly noted during the 2009 H1N1 pandemic, where a study in 12 states that have a high proportion of American Indian and Alaska Native people found that American Indian and Alaska Natives were 4 times more likely to die from an H1N1 infection than other race and ethnic groups. So it really is a serious health issue in the general U.S. population, but of particular seriousness in our American Indian and Alaska Native communities. So is there a treatment for influenza? There is. There are prescription medicines that are called antiviral drugs that can be used to treat flu illness, and they basically shorten the duration of the illness by 1 to 2 days. And they can prevent people who get the flu from progressing to very serious complications. The antiviral drugs work best when they're started within 2 days of getting sick. So that's why it's very important that if you think you have the flu or your person that you're taking care of might have the flu and they're at high risk for complications, you want to make sure that you notify your doctor early in the illness and not wait until you're already progressed pretty far in, because the antiviral drugs won't work as well. So the people who are at high risk for complications are similar to those groups of people that we saw who are more likely to have complications related to flu, and those are people with chronic health conditions, children less than 5 years of age, adults 65 years and older, and basically 90% of the deaths that we see each year are in adults 65 years and older. So they're a particularly important group to focus on, and of course, pregnant women. So the spread of influenza is a respiratory droplet spread. So basically, it can spread from person to person through droplets that you spread when you're coughing or you're sneezing or you're talking, or less commonly, but still possible, that you touch something with flu virus on it. So perhaps somebody sneezes and they cover their mouth with their hand, but then they reach for the doorknob. they could have left flu virus on that door handle, and the next person coming through can contract it, and then if they touch their nose and mouth, they can get the flu. If you think about all the common surfaces that we touch, computer keyboards and all of those types of things, you can see that the route of transmission is something pretty common that we all are experiencing every day. And I think the most important thing, especially when we talk about ourselves as caregivers and making sure that we're protecting the people we're caring for, is that you can spread the flu before you even know you're sick. So we used to hear this a lot from healthcare personnel who would say, well, if I'm sick, I don't come into work. The reality is with flu that you can be infected and not even know that you're sick, and you can spread the infection to others up to 1 day before you even have any symptoms. And then, of course, after you're sick, you can continue to spread influenza 5 to 7 days after you become sick. So it's a pretty long window in which you can be spreading influenza. So you may be feeling better and you come back to work after 3 days, but you could still be spreading influenza. And I think more importantly is the fact that even though we may all do our best to stay home when we're sick, you could be infected and not realize it and unknowingly pass influenza on to other people. And this is, I think it's a great screenshot of sort of just a normal person who's just, coughing or sneezing, and this is the spray that you get from that. And you know that even if we're practicing good cough etiquette and covering with our elbow and making sure we don't spray it everywhere, the reality is with a spray that big, you're going to get some droplets outside of your arm. And so the potential for transmission is really there, and influenza really is highly contagious. This is why we want to work so hard on preventing the flu. And, of course, hand washing and good hygiene, all of those things that help spread any number of diseases, including influenza, are really, really important. So what we know from the studies is that the flu vaccine is actually the best way we have right now to prevent influenza. It may not work 100% in everybody, but it really is still the best tool that we have to prevent influenza. And it keeps you from getting sick from the flu. But I think almost more importantly, as we think about our roles as caregivers, in addition to protecting yourself, is that you also help to protect the people around you, particularly those who are more vulnerable to serious flu illness. And this is actually one of the reasons why the Indian Health Service, as well as a number of hospitals and healthcare facilities across the country, have started to require that personnel who work in the healthcare setting must receive an annual influenza vaccine. And this policy did go into effect in the Indian Health Service partially last year, but in full implementation this year. And all of our healthcare personnel are required to receive an annual influenza vaccine to protect not only themselves, but for their patients, because our doctors and our nurses and the staff that are in our medical facilities are encountering the most vulnerable people in our population who are sick already and coming to us for care. And the last thing that we would want is to transmit influenza to a vulnerable elderly person who came in to have their diabetes taken care of, and we give them the flu, and then they experience serious complications. So healthcare personnel in the Indian Health Service are now all required to receive their influenza vaccine. In terms of the flu vaccine recommendation, the recommendation is that everybody 6 months and older should get the flu vaccine. So that means healthy adults, that means older adults, that means pregnant women, everybody. And as I mentioned, there are some groups that are at higher risk, and we really want to make sure that those people get vaccinated. But it's also important that even those of us who are relatively healthy or younger adults get the flu vaccine. Because even if our elderly parent gets the flu vaccine, they may not have as good a response to the vaccine as we would. So their immune systems are deteriorating. People who have underlying health conditions may not be able to get as much protection from the flu vaccine. And so even though they get vaccinated, that may not be enough to protect them. And so what we can do in our role as a caregiver is to make sure that we get those flu vaccines so that we create that extra layer of screening around them. So how are we doing in the Indian Health Service? This is some data from last influenza season looking at our flu vaccine coverage. I don't see that the legend didn't come out for all of the lines, but the blue is the children, the orange is the adults, and the green is everybody combined. And basically, you can see that the goal for the country for Healthy People 2020 is that 70% of patients receive the influenza vaccine. And actually, what we see when we look at this graph is that not only is our coverage quite far away from that goal, last flu season, less than 40% of our patient population received the flu vaccine, But we also see that coverage over the last several years has really flattened. So we are not seeing an uptick. We are not seeing increases in influenza vaccine coverage. And this is the nut that we really need to crack to make sure that our communities are protected. We really need to work on increasing influenza vaccine coverage for all age groups. So in terms of flu vaccines, there are many different strains of the flu virus, and every year they pick the ones that they think are most likely to infect people. So it is a little bit of a game to try to figure out which ones. And they use a lot of epi data from the southern hemisphere as well as here in the U.S. to determine which of the many strains of influenza virus are circulating and the ones that are most likely going to be infecting people. And they change every year, and that's actually one of the reasons why you need to get a flu vaccine every year. But it's really important to note, and you will see me make this statement several different times in several different ways, is the flu vaccine is made up with just pieces of a killed flu virus or an activated flu virus. So when you get the flu vaccine, it is impossible for you to get the flu from the flu vaccine. The virus contained in the vaccine is just a piece of it, and it is killed, and so it cannot replicate itself in your body. So you cannot get flu from the flu vaccine. And flu vaccines are very safe. I often hear this as a concern that people cite, and I can certainly appreciate the importance of safety and the need for us to continue to monitor it. But I do want to highlight again, you can't get the flu from the flu vaccine. It's literally biologically impossible for that to happen. And with this vaccine, we've actually been giving influenza vaccines for over 50 years. Granted, the composition and the formulation has changed over that time, but we have a lot of experience and history with this particular vaccine. And it's been given to hundreds of millions of people in both the United States and globally around the world. And we continue to monitor it. We don't just say we know it's safe and stop monitoring it, because the flu vaccine changes every year. We do make a point of continuing our surveillance to make sure that the vaccine is safe from year to year. A lot of times people are concerned they have a chronic health condition, they shouldn't get the flu vaccine. That is actually a really important group to get the flu vaccine. So people with diabetes, heart disease, and asthma, we really need to make sure they get the flu vaccine to protect them. In addition, pregnant women is a very important group. If a pregnant woman gets the flu vaccine while she's pregnant, she not only protects herself, and we have found that pregnant women are more likely to have serious complications if they get the flu, but more importantly, when their baby is born, that baby actually has some protection against flu as well. And that's very important because children less than 6 months can't get the flu vaccine themselves. So by vaccinating pregnant women, we actually help to provide protection for both the mom and the baby once the baby is born. There are side effects from influenza vaccines, just as there are for any medication. Serious side effects are extremely, extremely rare. And the most common ones that we see usually resolve in 1 to 2 days, and that can be soreness or redness where you got the injection, maybe a slight fever or body aches. And all of those things are signs that your body's own immune system is ramping up and is responding to the flu vaccine and creating those antibodies to provide protection. So those side effects are actually a sign that your body's immune system is working. And the reality is that the side effects you might get from the flu vaccine are going to be much less serious than it would be if you actually got the flu. There are groups of people who should not get the flu vaccine. Children less than 6 months of age can't receive the flu vaccine, which is why it's so important that we make sure everybody around them is vaccinated. And anybody who's had a severe or life-threatening allergy from a flu vaccine or an ingredient in the flu vaccine should not get vaccinated. For a long time, people with egg allergy were cautioned to not get the flu vaccine. That has actually really changed over the years as we've gotten more information, and we actually also have some flu vaccine formulations that do not contain eggs. So in general, we would recommend that if you consult with your doctor before getting vaccinated, if you do have an allergy to eggs, but you can still get vaccinated, but we do encourage you to consult with the doctor first. Anybody who's ever had Guillain-Barré syndrome, which is a paralyzing disease, should also talk with their doctor before getting flu vaccine. Or if you're acutely ill, if you're already under the weather and not feeling well, you should probably wait and defer your flu vaccine. But consult with your doctor under any of those circumstances. And finally, again, just to reiterate, can you get the flu from the flu vaccine? I put this in here 3 times because it really is the number one issue that we struggle with. You can't get the flu from the flu vaccine. It's made up of pieces of killed or inactivated virus. But it does take up to 2 weeks after you're vaccinated before you're fully protected. And so some people will say, I got the flu vaccine and then I got sick, and they're convinced that the flu vaccine is what made them sick. The reality is that it could be that they were actually already infected before they got vaccinated. It could be that they got infected with any of the other number of respiratory illnesses that are circulating in the wintertime that is not flu, so the vaccine wouldn't protect against it. Or it could be that they got vaccinated, but in that 2-week window while their body was mounting that response to protect them, they got infected with the flu. And this is why it's so important to not wait to get vaccinated. I think what we hear happen year to year is people say, well, I'll wait, flu's not that big a deal. Then there's a big community-wide outbreak, and everybody panics and goes and gets vaccinated. If you wait until there's an outbreak in your community to get vaccinated, you're going to be susceptible for 2 weeks until that vaccine takes place. So we really encourage people, don't wait for there to be flu before you get vaccinated. Get vaccinated now and be prepared in case there is an outbreak in the future. And then finally, I think as caregivers, this is also the number one thing that I hear from a lot of people. I'm perfectly healthy. I don't get sick. I take care of myself. If I do get the flu, I'm not at high risk. I don't need a flu vaccine. And that may be fine for a certain subset of people. But none of us live in an island. We're not completely separated or quarantined from other people. And I think the reality is that even if you feel that you personally don't need the flu vaccine, even though we know that healthy adults can get the flu and healthy adults can die from the flu, the reality is that even if you don't want to get it for yourself, get it for your community and those around you. You can get sick from the flu, but you can also spread it to other people who may not have your healthy immune system. So if you don't want to get your flu vaccine for yourself, please consider getting it for your family, for our elders, and for the infants in our communities who cannot get vaccinated. So again, just really encourage everybody to think more broadly. And as caregivers, I know you're already doing that for the people that you're taking care of. Think about them, think about yourself, and really protect that circle of life by protecting yourself and your family and your community, and get your flu vaccine today instead of waiting till you hear that flu is there. It is a serious disease, and it's something that we really want to encourage people in their roles as caregivers to make sure they're doing. So finally, I'm just going to repeat my poll question. I don't know that my information has convinced anybody if you weren't going to get it, but if you could just take a few moments and let me know if you've gotten or are planning to get your flu vaccine this year, I'd really appreciate it. For those of you who may still have concerns about it, if you have specific questions, please do put them in the chat box. We will have time for questions at the end. So I can see that we have the majority of people will get it. We still have a couple of people who won't. And again, there are reasons why you may not be able to get it for medical contraindications, etc. But if there are questions you have, please do put them in the chat box. I would love to share more information with you. So thanks very much. I'm going to turn it over now to PJ, who's going to share with you some wonderful materials that his organization worked on around flu and immunization. So PJ.
Thanks, Amy, and thanks for having me. It's an honor to be on this webinar. Like Amy mentioned, my name is PJ Beaudry, and Julie mentioned, my name is PJ Beaudry. I'm the director of the Great Plains Tribal Epidemiology Center. We're located in Rapid City, South Dakota, and housed within the Great Plains Tribal Chairman's Health Board. So just a really brief background about tribal epidemiology centers. You might not be familiar with them, but there are 12 tribal epidemiology centers throughout the country that serve each IHS service area, as well as all of the urban Indian health centers throughout the country and health organizations throughout the country. And the tribal epicenters, our mission is to improve the health status of American Indians and Alaskan Natives by identification and understanding of health risks and inequities, strengthening public health capacity, and assisting in disease prevention and control. And we're primarily funded through a cooperative agreement with the Indian Health Service Division of Epidemiology and Disease Prevention, but we do also receive other funding streams associated with or to conduct certain activities related to our 7 core functions. And I can put it in the chat box or whatever might be helpful, but for more information about tribal epicenters, if you're interested, we do have a new website, tribalepicenters.org. So just to kind of provide some background on the project that Amy mentioned, we did begin pursuing a couple of years ago now this Community Health Representative and Adult Vaccination Project, which was funded by the National Vaccination Program Office. And I'm not going to belabor these points too much, but as Amy mentioned, the context was really that we had less than ideal uptake of vaccinations among adults in many IHS regions, and of course that was leading to negative health outcomes. And we knew that we needed to engage better with tribal communities to educate on the importance of adult vaccinations, and that we had a really great group of people and really dedicated group of people to help us do so through in CHRs. So the project was based upon, these really extensive partnerships between the Epicenter, Amy's group down there in Albuquerque, several other organizations that you can see on the slide here, as well as informed by our CHRs here in the Great Plains region and across the country. And what ended up coming out of that was a variety of different results. We're going to highlight the flu materials today, but I'll also go through the adult vaccination materials a little bit. And what we tried to do was create light messaging that was informative but also fun, and was directly influenced by what we heard from information gathering efforts that we conducted with CHRs and other partners. And all of the messaging is being put through, or a lot of the messaging is being put through Good Health TV, which is run by an organization out of North Dakota called CAT Communications, and provides clinic-level information through the TV, video PSAs, banners, clinic-specific information, things like that. It's an excellent service, and we were glad to be able to put our information through that. As well as we developed some companion materials for healthcare extenders, fact sheets, FAQs, as well as index cards for tracking vaccinations to support some of that outreach and education and promotion of adult vaccination at the community level. And you can see one of our posters here on the right, and I'm going to show you a couple more as well. So just so you guys know, or everyone on the line knows, you can access all these materials, or most of the materials at this point. We did have some turnover in our web update staff, so if there's things aren't quite up there yet, it should be up there soon. On our website, which currently is the URL that is at the bottom of the screen here, under our National Vaccination Project. So all the videos, posters, fact sheets either are up there already or will be going up there soon. And as you can see, we actually used to be called the Northern Plains Tribal Epicenter, so I just wanted to alert people that currently the URL is neptech.gptchb.org, but it will at some point be changing to gptech@gptchb.org. So I did want to include both of those URLs in the presentation so that everyone can access those materials. So in terms of the flu vaccination material specifically, you can see the still of the video here, and we're actually going to watch that video here in a few minutes, as well as another one of our flu posters. And as Amy mentioned, we really tried to highlight in this campaign some of those key barriers in terms of, and answer some of those key questions that people might have about the flu vaccine, and empower both patients to understand the vaccine and some of those healthcare extenders to promote them and give them the tools that they might need to do so. And you might notice this guy on the front page here. His name is Joe Creelbad, and we actually he's the star of other health messaging programs and campaigns that are aired on Good Health TV. So we developed this messaging in partnership with CAT Communications, and we utilized Joe and his character as a way to sort of build that recognition among patients and clients that might have experienced him in other settings and might engage with the videos more directly because of that. So we also have our adult vaccination materials here, and you can see another still from the adult vaccination video that we prepared. And again, both of these videos are on the website. And this video was pretty cool because we actually had a CHR from here in the Great Plains area that starred in that PSA as well, or that video messaging as well. So, and we got excellent feedback on that, which was great. So I noticed there's some of my images, unfortunately, didn't translate over in the slides, but the vaccine card is on that website that I provided, and essentially what it looks like is the front half is sort of some imaging and promotional messaging, and then the back side actually has essentially lines for all the different adult vaccinations that might be recommended for an individual, and those with kind of lines for people to enter dates of when they got those vaccines. And what we anticipated was that the CHRs and PHNs and other healthcare extenders might be able to disseminate those cards to their clients, and those clients would therefore be empowered to track their own vaccination history. And we're also going to be working with some of our clinical partners with the Indian Health Service to disseminate those cards to providers that'll actually be supplying those vaccines to, again, kind of attack it from both sides. So like I said, we also developed these companion materials for CHRs that we sought to developed to answer questions and address particular barriers associated with vaccines. So again, the images are a little bit grainy here, but those either are or will be up on the website fairly soon. I don't think these are up there yet, but hopefully we'll be getting them up soon. And then we also developed, based on feedback that the CHRs were interested in this information, was these kind of basic guides to adult vaccinations that indicated what vaccinations might be recommended, who they might be recommended for, and in what situations, and how efficacious they are, things like that. And of course, with the kind of underlying message being nothing replaces communication between a patient and a provider about which vaccinations are right for them, but that at least this gives CHRs and other extenders a starting point to communicate with their clients and their patients. So I think at this point we're going to show that flu video, and then we'll just kind of pick your brains a little bit about the some questions that we had about the materials. So we'll go ahead and get that video started.
Hi, I'm Joe Creelbad. You might recognize me from a little program called Good Health TV News. Sure, you all know and love me as a news anchorman, but did you know that I'm also a real person in real life? Well, believe it or not, it's true. And as a real person, it's no secret that I have real problems.
Here you go, Joe. Freshly pressed.
Freshly pressed? I said to iron it. Try again. One problem I can't afford to have, the flu. Now you might think that's just because I'm famous. But the reality is I've got a lot of family and even more fans counting on me every day. That's why I get a flu vaccine every year. The flu vaccine is safe and can help protect me, my family, coworkers, and community from the flu. I can't bear the thought of letting them down just because I'm down with the flu.
Joe, your son's on the phone. He's wondering if you're coming to his championship game tonight.
Oh, shoot, that's the night. Have him reschedule it to Wednesday after my aerobics class.
I don't think they do that for people.
As for the rest of my family, it's especially important for them to get vaccinated because if they get the flu, it can be really serious. Take my wife, for example. She's at higher risk because she's pregnant. And my 1-year-old baby daughter's at higher risk because, well, she's just a baby. I learned that she could get a vaccine as early as 6 months old, so I brought her in as soon as I could. Hey, have you seen my world's greatest father coffee mug?
I'm sorry, I don't work here.
As for Grandma, once I informed her that the elderly were also at higher risk for serious illness because of the flu, well, she pinched me really hard for calling her elderly. And I deserve that. But once I informed her that she was even more at risk because of her heart disease and other chronic health issues, she went in and got vaccinated the very next day. I love that woman. Oh, I forgot to mention my wacky cousin Arnold. He crashes on the couch without warning and a little too often. Well, even though he himself hasn't been vaccinated yet, it's at least comforting to know that he's far less likely to give us the flu or get the flu from us because we're all one big, loving, vaccinated family. Which reminds me, Deborah.
Yes, Mr. Krillbad?
Set up an appointment with a good couch cleaning company.
Is that a real thing?
As Native American people, we need to keep our circle protected and strong. It's up to each one of us to make sure our loved ones are protected from the dangers of the flu. I get the flu vaccine. Do you? Hey, that rhymed. I'm like a poet and didn't even realize it.
That was very clever, Joe.
Yeah, nice one.
Oh, thanks. You ever have one of those days where everything you do is just amazing? I think I'm having one of those days. Oh, let's see here.
The flu can be a very serious illness. Protect your family and the circle of life by getting a flu vaccine every year. Ask your doctor or other provider about getting a flu vaccine today. For more information, contact your local health facility or visit cdc.gov/flu.
The flu is a contagious disease that affects the lungs and can lead to serious illness or even death. Even healthy people can get sick enough from the flu to miss work or school. The flu vaccine is the best way to protect you and your family from the flu virus. The flu vaccine is safe. You cannot get the flu from the vaccine. Everyone 6 months and older should get a flu vaccine every year. Protect the circle and keep it strong. Talk to a provider and get your flu vaccine today.
Before we move on, I hope you guys like the video. And before we move on to a few questions, I just wanted to mention one quick thing, which is that, as I mentioned, that video was aired on Good Health TV. And we're actually working with Cat Communications to try to do additional airing of that video through Good Health TV, which is primarily aired in Indian Health Service and tribal health facilities throughout the country. And you saw that there were also some slates that we put together at the end. And I did want to mention, too, with regard to the materials in general, that we're actually pursuing with some of our partners the possibility of making some of the materials a little bit more general so that folks can put their own branding onto it and use those in their own areas with their own images and things like that. So that's definitely something that's kind of potentially coming down the pipeline as we kind of work to figure that out. And I think we're just going to jump into a few questions that we wanted to ask you guys about some of the materials and things like that before we move on. So first off, was the flu video informative? Did you find it contain good information? Excellent. I'm glad to see that most folks found it informative, and we definitely did try to find that right balance between making it informational and contain the best information that we could have it, but also some of that humor and engaging the audience. So striking that balance definitely took some time to figure out, but it was worthwhile with the product that we developed. We can move on to the next question. Whoops, sorry about that. So the next question is, do you think the flu video will appeal to your community? Awesome. I'm also glad to see that most folks felt that it will appeal in their area, and we definitely did try to strike, again, that balance between, having that resonate with Great Plains tribal communities where I'm from and, where the project was housed, but at the same time to have it resonate with a national audience as well. And hopefully we can continue to pursue that by, again, making those materials a little bit more editable and for individual different communities and areas. So that's excellent. I think we'll move on to our last question, unless any last votes want to come in. So the last question is, do you feel that you'll be able to make use of these materials in your area? Awesome. That's great. I'm really glad to hear that folks feel like they will be able to make use of it, and that's definitely what we were shooting for. And we're definitely more than happy to make that available, throughout the country for folks to use it. And I'd love to answer any other questions in terms of the process and how we develop those materials as well, if folks are interested in that. So I think I'm going to be handing it over to Barbara. But before I do, I just really wanted to say thank you all for participating, and thank you to Julie and her team for having me on the webinar, and I hope it was informative, and hope to talk to you more about these materials and to hear about how you guys are using them in your area. So thank you very much.
Thank you, PJ. Hello, everyone. It is a pleasure to be with you this afternoon. I'm Barbara Higgins, and I'm the program coordinator and trainer coach for the Region to Indian Country program. We work with staff in all federally recognized tribes throughout the nation to provide interventions to caregivers taking care of a loved one with memory problems. And our program promotes education, wellness, and stress management. Today, I'm so honored to share with you information that you can use and share with others on the importance of self-care. And later on in the talk, I'll tell you a little bit more about the REACH program. So some of you have the opportunity to live in a multi-generational home, and I did also. After my father passed, my grandmother moved in with us, and she had memory problems. I watched my mother's health decline because she was so busy taking care of everyone else, she neglected herself. The rule of self-care is to take care of yourself so that you can provide the best care to those that you love, and I absolutely know that this works. When you're on an airplane, one of the first instructions is in the event of a loss of cabin pressure, an oxygen mask will drop down, and you're instructed to place the mask over your nose and mouth and breathe normally. But they also add, if you're traveling with a child or someone who requires assistance, secure your mask first and then assist the other person. When you're 30,000 feet in the air, that makes perfectly good sense. But it also is a good idea when you're down on the ground. So since the holidays and festival seasons are just around the corner, I thought the first area to look at today is healthy eating. I'm not going to tell you something that you don't already know or probably haven't heard many times over, because there absolutely is no debate. A balanced meal and proper nutrition are essential in maintaining good health. So today I want to share just a few simple tips on how to help improve making better choices. One is cutting up your fruits and vegetables and placing them in a plastic bag so that they're convenient and easy to get to. And this is really great if you have young children in the home or you have seniors in the home. Another tip that's a little bit more expensive is to buy miniatures of your favorite snacks. This can help you limit your intake or use healthy alternatives to traditional snacks, like a Special K line of chips and snack products that's on the market. They're not as good as fruits and vegetables, but they're better than eating a whole bag of chips or a whole container of donuts and cookies. Buy fresh local produce if it's available, and even if it's not, the big retail outlets like Walmart have a much greater selection and variety than they used to. One other strategy is a modification on the concept of mindful eating. So as you select your food, preferably those healthy choices, but on occasion, if you grab that pound cake or that piece of pie, slow down and enjoy the process of eating. Enjoy the food, the flavor, the texture, the smell. Mindful eating gives your body time to let you know that you've had enough, and you may find that by really enjoying that one serving, you don't need or want another. Also, be sure to drink plenty of fluids, again, preferably water. Estimates suggest drinking 9 cups of fluid daily for women, 13 cups for men, and drinking water 30 minutes before a meal can make you feel fuller and help cut down on overeating. Again, do whatever works for you. A lot of people say they don't like the taste of water. If that's your situation, then just add a slice of lemon or orange, anything to make sure that you're being hydrated. And that's also important during the winter months. We hear about getting plenty of fluids during the summer, but it's important to also hydrate during the winter. Next on our list is exercise, and I think we all know the positive benefits of exercise. You feel better, you look better, you have more energy to get things done. There's a drug commercial, and the tagline on that commercial is, "A body in motion stays in motion." And that's true. One of the biggest challenges for many people, particularly caregivers, is finding the time to exercise. And here's where it's important to be creative. First, you don't need a lot of time. It's not necessary to work out an hour in the gym in order to see the benefits of exercise. Use what I call the KISS rule. Keep it simple, sweetie. So you want to start off with 10 minutes of sustained movement and then gradually increase it as you go. Most communities and churches are promoting health and wellness activities, so generally there are programs that are free or have minimal cost. And if none of that sounds interesting to you, if you have stairs or steps near your home, you don't have to go out and buy expensive equipment like a stair climber. Just go up and down your stairs for a designated number of times. You can even create a walking path in your home. And if you've got some great moves, turn on the radio. Turn on some upbeat music and dance around your house. That counts also. Anything that gets your heart rate up. My dogs are my own personal trainers because they inspire me to take short walks when I'm tired and I don't want to. Kids and grandkids would love to take a stroll with you. The key is finding something that you enjoy, because if you don't enjoy it, you're not going to use it. Just find something that gets you to move. Oh, isn't this a sweetheart here? Do you know how babies react when they're tired? I want you to think about that. Well, guess what? We react the same way. It's just it's not as cute when we do it. When you don't get enough rest, you can't function properly. So a few tips to facilitate a restful night include not eating heavy meals before you turn in. Establish a nighttime routine, and that simply means try to go to bed around the same time each night. Before you go to bed, turn off the television, put down the cell phone, turn on some relaxing music, or you might consider drinking a soothing cup of tea. Have a moment of meditation, and we're not talking about a long time here. 5 minutes to clear your mind from distracting thoughts. A few other tips include reducing the clutter in your bedroom. You want to create a relaxing environment. So if you have a lot of clothes and paper and toys and things around in the bedroom, simply get a box, put those things away so that you have a relaxing environment. Another thing to consider is the temperature of your bedroom. 65 to 75 degrees is ideal for sleeping. That's generally not a problem during this time of year. And if you are having chronic problems with not being able to sleep, please bring this to the attention of your care provider. Well, one of the areas that we focus on in the REACH program is stress management. And the first technique we teach during the very first session is the signal breath. The signal breath is a form of focused breathing. We won't go into all of the instruction today, but I do want to demonstrate that just by taking a moment to breathe, you feel better. So I'd like everyone, I'm going to assume that everybody is sitting down. I want you to sit up in your chair, put your feet on the ground. We're going to take 3 deep breaths together. We're going to hold them for a few seconds, and then we're going to slowly exhale while thinking of a calming word or a happy image. So let's take a deep breath and hold it. And now slowly exhale. Take another deep breath and hold it. And slowly exhale while saying a very calming word or thinking of a calming image. And let's take our last big breath and hold it. And slowly exhale. I think you all, hopefully no one feels more anxious. We probably all feel just a little bit more relaxed. Another technique we use in the program is called mood management. And it's a simple one to get the hang of it. It's quick, it's easy to use. It's especially useful when you encounter a situation where the only thing that you can control or change is the way you feel about it or the way you think about it. If you know someone who's taking care of a loved one with memory problems, or you have a family member who has memory problems, you know that you can't make them better. But you can learn to think about it differently. The goal in our program is to help caregivers make the connection between their thoughts and their feelings or their emotions. And there are 5 steps to the mood management technique. The first one is to identify the situation, and then you identify your thoughts about that situation. You recognize what feelings those thoughts generate, and then you simply change the way you're thinking in a milder, more positive way, and then you'll match those feelings with your new thoughts. Here's an example. and we use a thought record in our program. Lydia is taking care of her daughter, Jane, and Jane becomes angry or upset when anyone other than her mother provides care for her. Lydia has been asked to attend a social event, but she's really concerned about how Jane's going to react. Her thoughts about not being able to go is that Jane's being selfish and she doesn't think about me, and no one else is going to be able to give her good care. I'm never going to be able to get a break. That generates feelings of frustration, anger. She feels trapped. She feels stressed. To not only work with Jane on changing her feelings. And her new thoughts are, well, Jane's not necessarily being selfish. She may be frightened that someone's going to hurt her, or she may be embarrassed to have someone she doesn't know take care of her. And then Lydia thinks, well, maybe I can get someone she likes or she feels comfortable with. When she thinks in those terms, her new feelings, where she's less angry, she's less frustrated, she's hopeful that a solution can be worked out. Now, it's not always easy to make those healthy choices, but it is always worth it. I discovered this quote a few weeks ago, and I think it's a great motto for self-care. Sometimes we don't reach our goals immediately, but we have to keep trying because the alternative is far worse. And the tips I've just shared with you are suggestions that you can try to help you be a better you. I want to take just the last few minutes and talk about the Reach into Indian Country program. Now, Reach stands for Resources for Enhancing Alzheimer's Caregivers' Health. At Reach into Indian Country, the target goal is to implement the program into tribal communities. Reach is a proven dementia caregiving behavioral program, and the funding for our program is over 3 years. We are now into the second year of that 3-year period. Over the past year and a half, we've had great success in training and certifying staff to provide the intervention. We actually have 47 communities that have the program, and our goal was 50. So I think that states were really kind of working ahead of where we thought we'd be at this point. And there's still opportunity to get trained. However, our focus now is the urgency of getting this resource into the hands of our caregivers, who we know could greatly benefit from the information and the support through programs like Reach. Every caregiver who's enrolled in the program will receive a caregiver notebook, and the information in the notebook is very accessible because it's written in simple, concise language. We have large print for our senior caregivers, and the strategies that's offered in the book are very similar to what we talked about today. They appeal to caregivers because they were developed from the feedback we got from caregivers over the years, telling us what worked for them and what were the topics that they found most useful. We encourage our caregivers to share this information with other family members who might be assisting in providing care to an elder with memory loss. We like them to think of the caregiver notebook as their caregiver center in their home. Currently, this notebook is not available anywhere else, and it is provided at no cost to every caregiver that's enrolled in the program. Now, the program is designed to be simple and easy to implement. The intervention has 4 core sessions. During this time, the program coach will work with caregivers to learn problem solving, positive thinking, and stress management techniques. The intervention can be delivered over a 2 to 3 month period, and it can be done face-to-face, partially or completely over the phone. What we do know is that Reach participants improve in the areas of caregiver depression, burden, frustration, and it's also effective in reducing the number of problem behaviors that dementia patients or patients who have memory loss many times exhibit. A real quick example of the problem solving. Many of the problems, if you're familiar with people with memory loss, common problems are eating, bathing, wandering, and dressing. So the problem here is an increased dependence on dressing because the care recipient or the patient can't pick the appropriate clothes or find clean clothes to wear. There are many solutions, and this is just an example, but REACH really strives to work with that caregiver in what's going on in their particular situation. So here, this might be the caregiver's closet. Now, it would probably be difficult for any of us to figure out what to wear, but if you've got memory loss or dementia, this is really overwhelming. So we look at the caregiver's personal situation and we come up with simple strategies that don't cost a lot, that they feel comfortable trying. In this case, it would be simply to either remove the clutter or to simply pick out a couple of outfits that the patient or their loved one would feel comfortable using. It reduces the level of agitation on the patient's part and the level of stress and frustration on the caregiver's part. There are many benefits associated with the REACH program. If you're a program director or tribal leader, it maximizes the time and interaction that the staff has to spend with the caregiver because everything is laid out, including scripts for people who may not be comfortable or familiar with working with dementia caregivers. It gives the caregiver exactly what he needs or she needs, and it empowers the caregiver to continue to work on concerns when they're no longer in the program because now they have new skills. Anyone can be trained to do this. If you work with a caregiver on a regular basis, you can do this. Again, I can't emphasize how much it's important that it's currently being offered at no cost. All of our training is web-based. Here are upcoming training dates. If these hours are not convenient, arrangements can be made to accommodate work schedules as well as to assist any staff that might have limited internet resources. Here's my contact information. And before I go, I know that this is a busy time and flu prevention is a major concern. But this is also a good opportunity to identify potential candidates for the REACH program. So while you're interacting with families in their homes and possibly the clinic, make note of any family members that are taking care of elders who might have memory loss. And if you're a caregiver, please contact me and we'll see what resources are available to you. I want to thank you all for your time and your attention, and now we'll turn it over to Julie for questions.
Thank you, Barbara, and thank you to our other presenters. We have reached the top of the hour. However, we will extend for a few minutes longer in order to have a Q&A session. So with that, we will go ahead and transition into question and answers. If you have a question, go ahead and type your question into the Q&A box on the bottom left of your screen. We do have one question. And it is, what paperwork needs to be turned in with the application for clients going into long-term care or home and community-based services? Can PJ, Amy, or Barbara speak to that? Okay. Since that topic is a little off of the subject, we can go ahead and move on to the next question. Amy, this one looks like this would be good for you. What is the role of IHS in immunization?
Well, the Indian Health Service has the clinical infrastructure and provides flu vaccine to all of its patients and all of its clinics. So I think that's the role they play. I think what we struggle with in IHS is the community education piece and how we engage with the community side of the house to increase demand for flu vaccines. So that's really what we're looking for folks like you in the field to assist with that.
Okay. And Barbara, this looks like a question for you. Is there a minimum number of caregivers that you must have in order to be REACH trained?
No. If you get one caregiver, we're happy. We just had someone who had 11, but no, there is no limit. If you work with a caregiver, we'd rather caregivers be enrolled in the program, regardless of the number.
Okay, and are the posters shown in the slideshow available, the ones promoting the flu vaccine?
So I think
This is PJ.
For the posters they showed, and then we also have the ones on the IHS flu website, which is www.ihs.gov/flu. We have links to many of the posters I had in my presentation, as well as the ones that PJ showed. And PJ, do you want to walk people through where they can find specifically the ones you shared?
Yeah, so I don't know if we can go back to my slides, Julie, but if we can for a second, that would be good. And I can navigate back to the one that shows. So like I said, the materials are all available on the NEPTEC website or the GPTech website. And actually, this is a screenshot of our website. And if you just type in this URL, that'll get you there. But the other thing is, if you manage to find your way to our website, if you click on this resources tab up in the toolbar up at the top there, let me see if I can draw something on there or something. The resources tab right there at the top, that'll actually drop down, and then there's an option for public health resources. And that'll take you to a page where you can select the National Vaccination Project, and that's where the materials are. So the posters are up there. We're only missing one poster, one of the adult vaccination posters that we weren't able to get updated before we had turnover in our web development staff. So once we have those positions filled again, we'll be able to upload the remainder of these materials. And as I mentioned, we're hoping to potentially pursue the possibility of kind of opening those posters up for folks to add in their own branding and images and things like that to utilize them in their areas. So that's something that we're kind of exploring with some of our partners, but might be coming down the pipe.
Okay, and then we had a request to get the time for the trainings that Barbara presented on, so I'm going to put that slide back up. Okay, and again, if you have any questions, please type them into the Q&A box. Okay, well, if there are no further questions, I'm going to leave it open for PJ, Amy, and Barbara to provide any last remarks.
Just get a flu vaccine. I think that's the take-home point that I wanted to make today.
Okay, great. Again, I would just like to thank each of our presenters for sharing their time and their knowledge on this topic. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online at cms.gov. Thank you again for joining today's webinar. Our session is now concluded.